Carrie is a first-time mother caring for her new baby boy. She notices that as she touches his cheek, he turns towards that side and opens his mouth. The nurse tells Gary that this is a reflex called dash. A. Plantar grasp. B. The rooting reflex. C. Palmar grasp. D. The Moore reflex. E. The Babinski reflex. The answer is B. The rooting reflex. The question describes the rooting reflex. The Moore reflex is shown when an infant is startled and or feels loss of support as if he or she is falling. He or she will extend the arms above the body in a curved shape. The Babinski reflex occurs in response to stimulation of the sole of the foot. Typically, the large toe will extend or remain extended as the others move. Infants may also exhibit plantar grasp with application of pressure to the foot. In plantar grasp, the toes will flex inward. Infants displaying palmar grasp will close their fingers around an object placed in their hand. Which of the following findings are abnormal upon assessment of an infant on the third day of life? A. Mottled skin. B. Firm stools. C. Blue tint to the hands and feet. D. Fine hair covering large body surfaces. E. Small, white spots present on the bridge of the nose. The answer is B. Firm stools. Hard or firm stools are abnormal for an infant on their third day of life. Typically, infants will have meconium, dark, sticky, stools for the first several days as a result of amniotic fluid ingestion. Over the next couple days they will transition to a seedy yellow, breastfed infants, or peanut butter consistency, formula-fed infants. Acrocynosis, blue color on the extremities, is normal in infants. Mottling is also common. Infants have a developing cardiovascular system and many capillaries that exist close to the surface of the skin. Milia are normal white spots that frequent the faces of newborns. It is important not to pick or scratch these white spots to prevent scarring. Infants are also frequently born with fine hair called lanigo covering the body's surfaces. Some babies may be born with more lanigo than others. While assessing a 4-month-old infant, the nurse notices hyperpigmented nevi on the lower back. Which of the following is false regarding hyperpigmented nevi? A. Hyperpigmented nevi fade over time. B. Hyperpigmented nevi are most commonly found on dark-skinned children. C. Hyperpigmented nevi are frequently mistaken as bruises. D. Hyperpigmented nevi may be scattered. E. Hyperpigmented nevi may be associated with Sturge-Weber syndrome. The answer is E. Hyperpigmented nevi may be associated with Sturge-Weber syndrome. Hyperpigmented nevi have been previously called Mongolian spots. They occur most commonly in dark-skinned children and fade as the child ages. They are often mistaken for bruises. Sturge-Weber syndrome is a neurological disorder which is present at birth and associated with port wine stain birthmarks. While using an otoscope, how does the practitioner correctly examine the tympanic membrane of a toddler? A. Pull back on the upper pinna. B. Pull forward on the upper pinna. C. Pull down on the earlobe. D. Pull upwards on the earlobe. E. Pull up on the upper pinna. The answer is C. Pull down on the earlobe. Examine the eardrum of infants and toddlers by pulling down on the earlobe. Examine the eardrum of an older child by pulling up on the outer pinna. Additional help from colleagues or caregivers may be necessary when examining small or upset children. Rubeola is caused by which of the following viruses? A. Varicella zoster. B. Measles. C. Human herpes virus. D. Coxsackie virus A16. E. Parvovirus B19. The answer is B. Measles. Rubeola is caused by the measles virus and is extremely contagious. Airborne precautions must be used when measles are suspected. Patients who are affected by measles may exhibit a high fever, cough, conjunctivitis and a rash among many other symptoms. Contraction of measles may be prevented by administration of MMR, measles, mumps, and rubella, through vaccination. Human herpes virus include a family of related viruses of which varicella, zoster virus, causes chickenpox and shingles, is a member. Parvovirus B19 may cause fifth disease, among other conditions. Coxsackie virus A16 causes hand-foot-mouth disease. Which of the following would be considered appropriate in the treatment of a child with Lyme disease? A. Restricted fluid intake. B. A clear liquid diet. C. Contact precautions. D. Promotion of bed rest. E. Administration of antibiotics. The answer is E. Administration of antibiotics. Lyme disease is caused by the bacteria Borrelia burgdorferi. It is a vector-borne disease that is contracted secondary to the bite of an infected tick. Administration of antibiotics is crucial to recovery. Standard precautions are adequate. Restricting fluids, diet, or activity is not necessary. A mother calls the clinic because her son is 5 years of age and has been experiencing incontinence of diarrhea for 3 days. He has a past medical history of constipation. The physician has diagnosed the child with encephalitis. The nurse may recommend the family try which of the following? A. Restricting activity until the diarrhea goes away. B. Encouraging a low-fiber diet. C. Limiting sugary food consumption. D. Giving the child an enema. E. Taking calcium carbonate tablets. The answer is D. Giving the child an enema. Constipation is a common complaint in children. Encephalitis occurs when children are incontinent of fecal matter after toilet training. Often, a child will leak stools surrounding a large fecal mass that has hardened in the rectum. Giving a child an enema may help to clear the mass and restore bowel function. Constipation should be avoided through exercise, high-fiber diet, and adequate liquid ingestion. A school nurse examines a 5-year-old child who comes into the office with belly pain. The nurse palpates McBurney's point and the child winces and pulls her knees to her chest. The school nurse phones the parents to tell them which of the following? A. The child should be taken to the hospital immediately. B. The child may be experiencing reflux, spicy foods should be avoided. C. The child should be picked up and brought home. D. The child is likely constipated and will need to be seen in the office tomorrow. E. If the pain persists, make an appointment to see the physician later in the day. The answer is A. The child should be taken to the hospital immediately. Tenderness over McBurney's point, 1/3 the distance from the anterior superior iliac spine to the navel, may indicate appendicitis. This should be treated as a surgical emergency and the child should be taken to the emergency room. Other symptoms of appendicitis include nausea, vomiting, fever, and frequent soft stools. Rubella is a viral illness that commonly affects children. Which of the following is another name for rubella? A. Chickenpox. B. Measles. C. Fifth disease. D. Hand, foot, and mouth disease. E. German measles. The answer is E. German measles. All of the above are viral illnesses commonly found in children. Rubella may be referred to as German measles and is spread through droplets. The disease is generally mild, presenting with a rash that typically lasts around 3 days. Maternal rubella may spread to the fetus and cause severe complications. Rubeola, also known as measles, is highly contagious and is caused by the measles virus. Chickenpox is caused by the herpes zoster, varicella, virus. Hand-foot-mouth disease is a viral disease caused by Coxsackie virus A16. Fifth disease is caused by parvovirus B19 and presents with bright red rashes on the cheeks and other parts of the body. The nurse is caring for a 1-year-old male client who has been brought to the emergency room because his parents state that he has been more fussy than usual. He has current jelly stools and is vomiting. What may the nurse suspect? A. Intussusception. B. Umbilical hernia. C. Pyloric stenosis. D. Inguinal hernia. E. Incapricis. The answer is A. Intussusception. Intussusception occurs when a portion of the bowel is pushed into another portion. It most commonly affects children under the age of 2. Red currant jelly stools, stool mixed with blood and mucus, vomiting, and pain are common symptoms. Red currant jelly stools are a hallmark of intussusception. Pyloric stenosis generally causes reflux post-feeding, and incapricis affects children who have already been toilet trained. Hernias are rare in young patients. Incapricis refers to involuntary fecal soiling in children who are already toilet trained, and does not involve abnormal stool, such as currant jelly characterization. Which of the following is a typical clinical sign of aortic insufficiency in a pediatric patient? A. Exercise intolerance. B. Excessive sweating. C. Frequent epigastric pain. D. Mania. The answer is A. Exercise intolerance. Exercise intolerance is a typical clinical finding in pediatric patients with aortic stenosis. This condition may present with any of the other symptoms, but mania, excessive sweating, and epigastric pain are not directly associated with aortic insufficiency in this population. Parvovirus B19 causes which of the following conditions? A. Roseola infantum. B. Fifth's disease. C. Rubeola. D. Scarlet fever. The answer is B. Fifth's disease. Parvovirus B19 causes Fifth's disease, sometimes referred to as slap cheek syndrome, due to the bright red cheeks that often present with the infection. Scarlet fever is caused by group A Streptococcus infection. Roseola infantum is caused by either human herpes virus 6 or human herpes virus 7. Rubeola, or measles, is caused by the measles virus. What is the incubation period for varicella, chickenpox? A. 48 to 72 hours. B. 14 to 28 days. C. 2 to 7 days. D. 10 to 21 days. The answer is D. 10 to 21 days. Varicella, caused by an infection with the varicella zoster virus, has an incubation period of 10 to 21 days. Which of the following infections is the most common cause of hand, foot, and mouth disease? A. Enterovirus 71. B. Human herpes virus 6. C. Parvovirus B19. D. Coxsackie virus A16. The answer is D. Coxsackie virus A16. The most common cause of hand, foot, and mouth disease in the United States is Coxsackie virus A16. Enterovirus 71 can also cause hand, foot, and mouth disease, though it is a less common etiology. Parvovirus B19 causes fifth disease, sometimes referred to as slap cheek syndrome. Human herpes virus 6 is one of two viruses that cause roseola infantum. While doing a standard ophthalmoscopic exam on a 7-year-old female, the examiner notices that while the light reflex of the left eye is red, the light reflex of the right eye appears bright yellow. The right pupil is also less reactive to light, and the right eye appears to be slightly bulging. The examiner should be suspicious of which of the following conditions? A. Cataract. B. Hordeolum. C. Pincula. D. Retinoblastoma. The answer is D. Retinoblastoma. Retinoblastoma is the most common form of ocular cancer in children. It is derived from developing retinal cells. The most common symptoms are a white or yellow light reflex, also known as leukochoria, diminished pupillary reflex, crossing of the eyes, impaired vision, and bulging of the affected eye. A cataract may also cause the pupil to appear white or to produce a white or yellow light reflex, but it will not cause bulging of the eye. A pincula is a fatty deposit on the sclera which will not alter the red light reflex, and a hordeolum is outside the eye itself. It is an infection of a hair follicle of the eyelid, also known as a stye. A labor and delivery nurse is speaking to a new mother about her premature infant, and is explaining why the infant will have difficulty with heat regulation. Which of the following statements made by the nurse best explains why a preterm infant cannot conserve heat properly? A. The preterm infant has an immature hypothalamus, which cannot set the infant's internal temperature properly, leading to large amounts of heat being lost via convection. B. The preterm infant has too little protein reserves around the kidneys, the neck, between the scapulae, and behind the sternum, and therefore cannot generate heat and can lead to hypothermia. C. The preterm infant has a lack of subcutaneous fat, and a large surface area to body weight ratio, as well as the lack of brown fat that provides heat to infants due to its unique thermogenic properties. D. The preterm infant lacks white fat, which provides the infant with a heat source due to underdeveloped and the inability to utilize the process of shivering to produce heat. E. The preterm infant cannot generate heat effectively because of a lack of surfactant in the skin and therefore cannot generate or preserve a proper body temperature. The answer is C. The preterm infant has a lack of subcutaneous fat, and a large surface area to body weight ratio, as well as the lack of brown fat that provides heat to infants due to its unique thermogenic properties. A preterm infant cannot conserve heat due to several reasons. The infant has a lack of subcutaneous fat, has a large surface area relative to their body weight, a lack of glucose reserves, and a lack of brown fat, which is a unique type of fat that is capable of generating a greater amount of heat than just ordinary fat. What specific enzyme deficiency accounts for 95% of all cases of congenital adrenal hyperplasia? A. 7-alpha hydroxylase deficiency. B. 21 hydroxylase deficiency. C. Beta-glucuronidase deficiency. D. Estrogen synthetase deficiency. The answer is B. 21 hydroxylase deficiency. In 21 hydroxylase deficiency, cortisol production is reduced, which in turn causes adrenocorticotropic hormone, ACTH, to increase. The precursors for the cortisol are then shunted into androgen production since these are steroids, and are thus derived from cholesterol. The community health nurse knows that teaching has been effective when the father of a newborn states A. I will place my child on her back to sleep. B. I will place my child on her back and in a crib with stuffed animals to create familiarity. C. I will place bumper pads in the crib to prevent injury. D. My child will sleep in the bed with me until the first month of life. E. I will place my child on her side to sleep, supported by pillows. The answer is A. I will place my child on her back to sleep. Newborns should be placed on their back, in their crib, with nothing else when put to sleep. The crib may contain a fitted sheet or light blanket. Crib pads, pillows, and stuffed animals are not advised because they may interfere with the child's ability to breathe. The postpartum nurse is caring for a family and their new baby, a 2-day-old infant. The baby is spitting up following every formula feeding. The nurse may suggest A. Giving only 15 to 30 milliliters per feeding. B. Laying the baby on its back after feedings. C. Switching brands of formula. D. Increasing the frequency of feedings. E. Using a soft instead of a standard bottle nipple. The answer is A. Giving only 15 to 30 milliliters per feeding. Typically, the digestive system of a 2-day-old infant can only accommodate 15 to 30 milliliters of formula comfortably. The infant's stomach will grow considerably over the coming weeks. Frequent spitting up could be due to overfeeding. Before switching formula brands, try decreasing the amount fed at each feeding. Increasing the frequency of feedings may add to this problem. Another possibility, that the infant is feeding too fast, may be corrected by using a slow flow instead of a soft or standard nipple. Soft nipples may be helpful in infants with poor suck or latch. While feeding and directly afterwards, it is advised to keep the infant in a semi-upright position. HA therapy has the ability to positively impact children who are cognitively, socially, emotionally, or physically challenged. Which of the following therapies is most closely related to HA therapy? A. Art therapy. B. Massage therapy. C. Pet therapy. D. Music therapy. E. Herbal therapy. The answer is C. Pet therapy. HA therapy is therapeutic horseback riding for the handicapped. The motion of the horse can help the child develop flexibility and balance. Working with others and animals can help the child cross social and emotional boundaries. A therapy involving animals, pet therapy, is most similar to HA therapy. Jennifer is a 14-year-old patient who has been diagnosed with diphtheria and subsequently, myocarditis. The nurse implements all of the following except A. Practicing standard precautions. B. Enforcing bed rest. C. Administering antitoxin. D. Administering antibiotics. E. Practicing airborne precautions. The answer is E. Practicing airborne precautions. Diphtheria is an illness caused by bacteria, Green Bacterium diphtheriae. It is spread through droplets, requiring droplet precautions. Standard precautions should also be used, as with any patient. Delivery of antitoxin and antibiotics are important to a patient's recovery. Enforcing bed rest is important after a patient has developed myocarditis, inflammation of the heart. A community health nurse is giving a presentation on pertussis, whooping cough. He tells his audience that which population is most at risk? A. Older adults above 85. B. Older adults from 65 to 75. C. Older adults from 75 to 85. D. Children under 4 years of age. E. Children from 4 to 12. The answer is D. Children under 4 years of age. Children under 4 years of age hold the greatest risk of contracting pertussis and developing serious complications, including death. Pertussis vaccines are recommended for all age groups. Children can start a vaccination series as early as 2 months of age. New parents are encouraged to become vaccinated before their baby arrives to prevent transmission before the infant is eligible for immunization. A room designed to accommodate a child with the measles should include which of the following? A. Negative air pressure. B. Low microscopy pressure device. C. Positive air pressure. D. No air pressure device is necessary. E. High microscopy pressure device. The answer is A. Negative air pressure. Measles is an airborne illness. For that reason, air pressure devices are necessary to prevent the spread of infection. Negative air pressure devices will adequately contain the measles virus because air will flow into the room as opposed to out. Conversely, positive air pressure devices may be used to create an airflow out of a room in severely immunocompromised patients. The school nurse is approached by a 9-year-old boy who is complaining of severe scalp pruritus. Upon closer examination, the nurse concludes that he has a case of head lice, pediculosis capitis. She knows all of the following to be true except dash. A. Treating the clothing of the child may be necessary. B. His personal grooming items should be soaked in hot water or shampoo. C. Sealing his backpack in a plastic bag for 10 days should kill the lice. D. His 5-year-old sister should be examined. E. Head lice may be a sign of poor hygiene. The answer is A. Head lice may be a sign of poor hygiene. Children and adults with exceptional personal hygiene are equally affected by head lice. The same applies to people of all socioeconomic groups, genders, and nationalities. All of the other options are true nursing interventions for head lice. A school nurse is holding a question and answer meeting for parents following a recent outbreak of scarlet fever. Which of the following would the nurse confirm is false? A. Scarlet fever is transmitted through the air. B. Children over 2 years of age are higher risk than children under 2 years of age. C. Scarlet fever is a viral infection. D. A rash develops secondary to toxin sensitivity. E. A child may or may not develop a rash after exposure. The answer is C. Scarlet fever is a viral infection. Scarlet fever is a bacterial infection caused by group A Streptococcus that is transmitted through the air. Children who are sensitive to the bacterial toxin may develop a rash, although some will not. Infants and toddlers under the age of 2 are rarely seen with the disease. A 3-day-old infant is diagnosed with hyperbilirubinemia. A bilirubin test is required by capillary heel puncture. The nurse does all of the following except dash. A. Using an antiseptic wipe to cleanse the foot. B. Squeezing the infant's heel while collecting the sample. C. Wiping away the first drop of blood. D. Turning off the bilirubin treatment lights before collecting the sample. E. Applying heel warmers to increase capillary blood flow. The answer is B. Squeezing the infant's heel while collecting the sample. Avoid squeezing the infant's heel if possible. Squeezing causes hemolysis of the specimen. Too much pressure may also result in damage to the tissue. Turning off the bilirubin treatment lights is also important because exposure to the light may alter the bilirubin in the sample. Cleansing the site of puncture is important, and warming the area will increase the capillary blood flow. A mother brings her child in for paroxysmal bouts of 10 to 15 coughs followed by 1 to 2 deep gasping breaths. It started as a simple cold and cough, which seemed to be getting better before the gasping paroxysmal coughing started. The coughing is severe enough that he has vomited several times. What is the most likely diagnosis? A. Pertussis. B. Croup. C. Bronchitis. D. Pneumonia. The answer is A. Pertussis. The most likely diagnosis in this case is pertussis, also known as whooping cough. This is caused by Bordetella pertussis, a gram-negative encapsulated coccobacillus. It begins as a seemingly normal upper respiratory infection, which progresses 2 weeks after onset into paroxysms of 5 to 15 violent coughs followed by a forceful inspiratory gasp, often described as a whoop. Coughing is often forceful enough to induce vomiting, nosebleeds, or subconjunctival hemorrhage. Croup, pneumonia, and bronchitis are all conditions that include cough, though none of them will generally present with this degree of gasping, vomiting, or blood vessel damage due to cough. Strawberry tongue and maculopapular, sandpaper, rash are commonly seen in what childhood exanthem? A. Scarlet fever. B. Varicella. C. Impetigo. D. Roseola. The answer is A. Scarlet fever. Strawberry tongue, glossitis, and maculopapular, sandpaper, rash are commonly seen in scarlet fever, a condition caused by group A Streptococcus bacteria, often after a bout of strep throat. The other exanthems listed can all cause erythematous rash, though none are associated with glossitis. Parotid gland enlargement, fever, myalgia, and tender salivary glands would indicate which of the following conditions? A. Rubella. B. Measles. C. Mumps. D. Herpes angina. The answer is C. Mumps. Parotid gland enlargement, fever, myalgia, and tender salivary glands are all indicative of infection with the mumps virus. Symptoms typically last for 7 to 10 days, though sequelae such as hearing damage and testicular disorders can be long-lasting or even permanent. A nurse working in labor and delivery is responsible to assessing a newborn according to the Apgar scale. The newborn infant is noted to have a vigorous good cry, a heart rate of 97, with good reflexes, and acrocyanosis. What is the newborn's Apgar scale according to these findings? A. 8. B. 9. C. 7. D. 6. E. 3. The answer is A. 8. The Apgar score is 8. The child has received a score of 2 under respiration for good cry, a score of 2 under cry reflex for vigorous crying, a score of 2 under reflexes for good reflexes, a score of 1 for heart rate of 97, under 100 bpm, and score of 1 for color for acrocyanosis, blue limbs, pink body. You are the nurse taking care of a 19-year-old patient at a primary care clinic who complains of fever, tonsillar exudates, tender anterior cervical lymph nodes, and a sore throat without a cough. How many of the center criteria for streptococcal pharyngitis does this patient exhibit? A. 4. B. 1. C. 3. D. 2. E. None of these. The answer is A. 4. The patient exhibits 4 out of the 4 center criteria for streptococcal pharyngitis. The center criteria are as follows: 1. Tonsillar exudates; 2. Lack of cough; 3. Fever; 4. Tender anterior cervical lymphadenopathy. The center criteria are used to generate a score based upon the patient's age and number of positive criteria. This score can then be used to assess the likelihood that the patient's condition is due to streptococcal pharyngitis, and therefore to guide the decision of whether or not to treat with antibiotics for streptococcal pharyngitis. In this patient's case, since they are older than 14 and younger than 45, they do not gain nor lose points for their age. They get 4 points total for having all of the positive criteria. Therefore, it is highly likely that they are infected with streptococcal pharyngitis and should be treated empirically with antibiotics. The pediatric nurse is counseling a mother-baby couplet who are having trouble breastfeeding. The baby is showing poor suck and falling asleep at the breast. Which of the following is not an appropriate intervention? A. Play with the feet of the newborn while feeding. B. Feed the infant according to infant's cues. C. Feed the baby every 3 hours until they become in sync with the pattern. D. Unswaddle and undress the baby prior to placing at breast. E. Gently caress or rub the head of the infant. The answer is C. Feed the baby every 3 hours until they become in sync with the pattern. When presented with an infant showing poor suck, it is important to feed when cues are given. The infant will suck best when hungry. However, a breastfed infant should not go more than 3 hours between routine feedings in order to establish healthy weight gain. Feeding every 3 hours regardless of cue is less advisable. Unswaddling, undressing, and stimulating the infant can sometimes aid in keeping them awake and sucking well at the breast. Individuals who contracted varicella zoster, chickenpox, in childhood may experience which of the following if the virus is reactivated later in life? A. Scarlet fever. B. Rheumatic fever. C. Orchitis. D. Shingles. The answer is D. Shingles. A common sequela of varicella is shingles, a painful rash caused by reactivation of the varicella zoster virus along the single dermatome that corresponds with the site of initial infection. Rheumatic fever and scarlet fever are both possible sequelae of streptococcus infection, and orchitis is a potential sequela or comorbidity of infection with the mumps virus. At what point is a child with varicella no longer contagious? A. By the time the lesions are visible, the child is no longer contagious. B. After the last lesion has broken open and crusted over. C. 7 days after the initial presentation. D. After the last lesion is no longer visible. The answer is D. After the last lesion has broken open and crusted over. Varicella is a highly contagious infectious disease of childhood. It is no longer contagious when the last lesion has broken open and crusted over. Until then, the virus can be spread via respiratory droplets, by contact with the saliva of an infected child, or by touching an unbroken blister or the fluid within a blister. What is the most common cause of renal failure in the United States? A. Renal cell carcinoma. B. Polycystic kidney disease. C. Drug overdose. D. Diabetes mellitus. The answer is D. Diabetes mellitus. The most common cause of renal failure in the U.S. is diabetic nephropathy due to diabetes mellitus. Diabetic nephropathy can include multiple complications including arterial sclerosis, glomerulosclerosis, pyelonephritis and renal failure. A nurse is caring for a client experiencing the oliguric phase of acute kidney failure. The nurse is aware that this condition is highly associated with electrolyte imbalances, in addition to the kidney's inability to produce sufficient amounts of urine. Which of the following electrolyte imbalances should the nurse monitor for? A. Hypernatremia and hypoglycemia only. B. Hyperlumbemia, hypercalcemia, and hypoglycemia. C. Hyperkalemia, hypocalcemia, and low bicarbonate levels. D. Hypoglycemia, hyponatremia, and decreased creatinine levels. E. Hypercalcemia, hypophosphatemia, and decreased nitrogen wastes. The answer is C. Hyperkalemia, hypocalcemia, and low bicarbonate levels. During the oliguric phase of acute kidney failure, AKF, the kidney is unable to excrete potassium properly, leading to high serum levels that could lead to dangerous CCG changes including peak T waves and wide QRS complexes. The kidneys are also responsible for activating vitamin D, allowing for proper calcium absorption from the GI, which becomes decreased during AKF. Bicarbonate is also handled by the kidney and cannot be regenerated properly by the kidney during AKF. An electrical worker has been brought to the emergency department after an electrical burn injury sustained while in the field. The possibility of additional injuries are greatly increased when dealing with this type of clinical scenario. The nurse examining the client should be aware that A. All patients with electrical burns are at risk for cervical spine injuries, and immobilization of the cervical spine should be a priority. B. The patient is at increased risk for metabolic alkalosis and should be receiving fluids continuously with the addition of sodium bicarbonate. C. Electrical burns are different from other burns in that the damage that occurs is readily visible. D. Massive losses of myoglobin from muscle damage can lead to liver dysfunction, thereby leading to liver failure. E. After an electrical burn occurs, the damage to the underlying tissues can continue for up to 72 hours. The answer is A. All patients with electrical burns are at risk for cervical spine injuries, and immobilization of the cervical spine should be a priority. The risk for cervical spine injury is high due to electrical workers being subjected to having to work on utility poles that upon electrocution may lead to falls from tall heights. This possibility puts the person at risk for spinal and long bone fractures. Electrical burns often lead to damage below the surface of the skin and may not be fully appreciated on visual inspection. Chemical burns can lead to continual damage over 3 days. Myoglobin in the bloodstream from muscle damage puts the kidneys at risk for damage, and the patient is usually at risk for metabolic acidosis, not alkalosis. Which of the following is an insect vector-borne illness? A. Rocky Mountain spotted fever. B. Rabies. C. Roundworm. D. Cat scratch fever. E. Scabies. The answer is A. Rocky Mountain spotted fever. Insect vector-borne illnesses are given to humans through insects like ticks, mosquitoes, and chiggers. Rocky Mountain spotted fever is caused by Rickettsia rickettsii. Ticks are the most common vector for Rocky Mountain spotted fever. Prevention of tick bites is a crucial teaching point in preventing the spread of the disease. Although misleading, the infection can be obtained throughout the United States of America. Roundworm is caused by a fungus. Rabies is a viral disease that is typically transmitted between mammals through bites. Cat scratch fever is a bacterial infection that can cause severe neurological, musculoskeletal, circulatory, and other system damage in immunocompromised individuals. In healthy people, no treatment is necessary and the infection is fought. Scabies causes extreme itchy red bumps commonly in between the fingers, on the wrist, and around the abdomen. The organism that causes this disease is actually in the arachnid family and is not an insect. Ed is an 85-year-old male who lives at a long-term care facility. He has recently begun having difficulty brushing his teeth, an activity he would previously complete on his own. He has also appeared to be more confused while engaging in basic conversation with the nursing staff. The nurse should first evaluate Ed for which of the following? A. Alzheimer's disease. B. Bipolar disorder. C. Infection. D. Creutzfeldt-Jakob disease. E. Depression. The answer is C. Infection. Changes in baseline cognition and functioning of older adults may be due to infection. Urinary tract infections frequently cause confusion. Evaluate for an underlying condition before testing for rare diseases or dementia. A 3-year-old child is admitted to the pediatric medical unit from the emergency department with suspected rheumatic fever. Which of the following is not indicative of rheumatic fever? A. A red rash over his arms and legs. B. A temperature of 102 degrees Fahrenheit. C. A red rash over his chest and back. D. A history of sore throat 3 weeks ago. E. A negative titer for anti-streptal isino. The answer is E. A negative titer for anti-streptal isino. Rheumatic fever presents with a red rash over the trunk and extremities, fever, and a sore throat. It is caused by an untreated streptococcus infection in the previous 2 to 6 weeks, such as strep throat, and can be confirmed with a positive anti-streptal isino titer. A nurse is teaching a 20-year-old male client newly diagnosed with herpes simplex virus, HSV, type 2. All of the following teaching points in regards to this condition should be included except which of these? A. HSV is a lifelong infection, with recurrent infections possible to the skin and mucous membranes. B. Certain factors may exacerbate the condition such as sunlight exposure, trauma, stress, or systemic infections. C. Transmission of the virus is possible by respiratory droplets. D. Recurrent episodes of HSV may exhibit grouped vesicles on an erythematous base. E. Nystatin, is a common drug used to treat flare-ups of skin lesions associated with HSV. The answer is E. Nystatin is a common drug used to treat flare-ups of skin lesions associated with HSV. Nystatin is an antifungal medication, not effective in treating viral infections such as HSV. Antiviral medications such as acyclovir, famciclovir, and valacyclovir would be prescribed to control symptoms and shorten episodes. These drugs are not curative. 35-year-old male has just been admitted to the emergency department in a sickle cell crisis. The nurse caring for this client is aware of the signs and symptoms associated with this condition. The proper nursing management for this patient should include which of these? A. Strict bed rest and hyperbaric oxygen therapy for 2 hours. B. Blood transfusions and antibiotic prophylaxis. C. Large doses of continuous analgesics for pain and oxygen to control sickling of the red blood cells. D. Give platelets and monitor hemoglobin and hematocrit levels hourly. E. Heparin administration and iron replacement. The answer is C. Large doses of continuous analgesics for pain and oxygen to control sickling of the red blood cells. A sickle cell crisis will require interventions to control the client's pain due to widespread tissue ischemia. Oxygen is needed to treat hypoxia and control the amount of red blood cell sickling. Blood transfusions are usually not first-line treatment in a crisis. The SIRS, Systemic Inflammatory Response Syndrome, criteria includes which of the following? A. Respiratory rate greater than 30 breaths per minute. B. Heart rate less than 100 beats per minute. C. Temperature greater than 38 degrees centigrade. D. PCO2 45 to 55 mm of mercury. E. None of these. The answer is C. Temperature greater than 38 degrees centigrade. The SIRS criteria includes 4 factors. 1. Temperature greater than 38 degrees centigrade or less than 36 degrees centigrade. 2. A respiratory rate greater than 20, or PCO2 less than 32 mm of mercury. 3. Heart rate greater than 90 beats per minute. And 4. WBC greater than 12,000 per cubic millimeters, or WBC less than 4,000 per cubic millimeters, or immature neutrophils greater than 10% bands. To meet the SIRS definition must have 2 or more of these findings. The fact that an elementary school is shut down due to a measles outbreak is an example of an N-A. Epidemic. B. Sporadic disease. C. Pandemic. D. Endemic disease. The answer is A. Epidemic. The terms outbreak and epidemic are very similar, except an outbreak is confined to a smaller place. Both indicate an increase in incidence of disease. An endemic disease is always present in the community in a low level. An example is the common cold. A pandemic is an epidemic that occurs across multiple continents. A sporadic disease occurs randomly or in scattered incidents. Which of the following physical exam findings would you expect to find in a patient who overdosed on heroin? A. Shallow breathing, normal respiratory rate, dilated pupils. B. Deep breathing, low respiratory rate, dilated pupils. C. Shallow breathing, fast respiratory rate, pinpoint pupils. D. Shallow breathing, low respiratory rate, pinpoint pupils. E. deep breathing, fast respiratory rate, dilated pupils. The answer is D. Shallow breathing, low respiratory rate, pinpoint pupils. Opiate, heroin, overdose is marked by a decreased respiratory drive, shallow breathing, and pinpoint pupils. Treatment is with naloxone and reverses overdose quickly. Heroin overdoses can be fatal if untreated because of the respiratory depression. A patient arrives to the ER in a comatose state. He is shallowly breathing, appears disheveled, and has pinpoint pupils. There are track marks on his right arm and it appears swollen. Which of the following conditions does this patient likely have? A. Opiate overdose. B. Benzodiazepine overdose. C. Alcohol overdose. D. Aspirin overdose. E. Anticholinergic overdose. The answer is A. Opiate overdose. This patient likely has opiate, heroin, overdose. Common signs of overdose include altered mental states, decreased respiratory rate and effort, and pinpoint pupils. Treatment includes inhalation of naltrexone to remove the opioids off their receptors in the body. Additionally, track marks are a sign that the patient injects heroin. A 23-year-old female comes in for urinary frequency and dysuria. This morning she noticed that her urine seemed slightly tea-colored. On UA the nurse sees a large amount of leukocyte esterase, moderate red blood cells, and a pH of 9.5. On lab analysis a gram-negative anaerobic bacteria with swarming motility is cultured out of her urine sample. If the organism identified in this patient's urine sample is Proteus mirabilis, which of the following would be the appropriate treatment? A 3-day course of either oral quinolone or trimethoprim, sulfamethoxazole. B. A 14-day course of ampicillin or cephalexin. C. A 21-day course of ampicillin or cephalexin. D. A 10 to 21-day course of oral quinolone or trimethoprim, sulfamethoxazole. The answer is A. A 3-day course of either oral quinolone or trimethoprim, sulfamethoxazole. The first-line treatment for uncomplicated urinary tract infection with Proteus mirabilis is a 3-day course of either oral quinolone or trimethoprim, sulfamethoxazole. 10 to 21-day courses are only appropriate in patients with complicated UTI or co-infections. Ampicillin and cephalexin are poor choices for initial treatment due to a 10 to 20% rate of resistance in Proteus species. A 23-year-old female comes in for urinary frequency and dysuria. This morning she noticed that her urine seemed slightly tea-colored. On urinalysis the nurse sees a large amount of leukocyte esterase, moderate red blood cells, and a pH of 9.5. On lab analysis a gram-negative anaerobic bacteria with swarming motility is cultured out of her urine sample. This individual is most likely experiencing a urinary tract infection, UTI, due to which of the following organisms? A. Proteus mirabilis. B. Staphylococcus aureus. C. Escherichia coli. D. Staphylococcus saprophyticus. The answer is A. Proteus mirabilis. While all of the organisms listed are capable of causing UTIs, Staphylococcus species are all gram-positive. Escherichia coli, while responsible for 75 to 95% of all UTIs, would not result in a urinary pH of 9.5. The high alkalinity of this patient's urine suggests a urea-splitting bacteria such as Proteus. A 23-year-old female comes in for urinary frequency and dysuria. This morning she noticed that her urine seemed slightly tea-colored. On UA the nurse sees a large amount of leukocyte esterase, moderate red blood cells, and a pH of 9.5. On lab analysis a gram-negative anaerobic bacteria with swarming motility is cultured out of her urine sample. In the case of chronic Prochus mirabilis infection, which of the following is a common sequelae? A. Pelvic inflammatory disease, PID. B. Bladder cancer. C. Renal calculi. D. Infertility. The answer is C. Renal calculi. Due to its production of ureas, Prochus mirabilis infection results in alkalinization of urine, as ureas hydrolyzes urea to produce ammonia. This can cause the formation of calcium, struvite, or apatite crystals in the urine, which may form renal calculi. P. Mirabilis is not associated with increased risk for infertility, PID, or bladder cancer. You are the nurse taking care of a 21-year-old female who complains of 2 days dysuria, that over the last 24 hours has been accompanied by fever, chills, and lower back pain. Her physical exam is remarkable for right-sided costovertebral angle tenderness. Which of the following is the most likely diagnosis? A. Genital herpes. B. Primary syphilis. C. Pyelonephritis. D. Pneumotrax. E. Spinal stenosis. The answer is C. Pyelonephritis. The patient's presentation with dysuria that progresses to include fever, chills, and lower back pain, is a very classic presentation of pyelonephritis. Pyelonephritis is an infection of the renal parenchyma, most commonly due to an ascending urinary tract infection. In this patient, who is a female, which places her at a greater risk for UTIs as compared to males due to females having shorter urethras than males, who initially has dysuria, this is a convincing story for a UTI. Further, the fact that the symptoms of fever, chills, and lower back pain are not present initially with the dysuria, but develop over the next day, is further evidence that pyelonephritis is the likely diagnosis. The physical exam finding of unilateral costovertebral angle tenderness also is highly suggestive of pyelonephritis. The other choices are incorrect. Spinal stenosis is not a common diagnosis in young, otherwise healthy patients, and would not account for dysuria and unilateral costovertebral angle tenderness. Pneumotrax would not cause dysuria and would likely present with shortness of breath. Primary syphilis and genital herpes would not account for dysuria, lower back pain, or costovertebral angle tenderness.